Hello, today is Sunday, February 18th, 2024, and I am RJ Valio, your host today for the Trans-Electronic News. Today's story, we are going to be looking at some evidence and examples of white blood clots as provided by Dr. John Campbell. Now, Dr. John Campbell is a nurse practitioner that is based out of the UK, and he has been following closely the pandemic and the response and any sort of side effects or situations that occur that we have not seen before. The thing that we're going to be looking at today are these white clots that he has been reporting that morticians have been finding in bodies as they are preparing the bodies for display for the families. And in previous videos, they've gone into depth into where they find these things, and I'm just going to let you know that this is going to be a bit of a graphic video, and if you're squeamish or if blood makes you uncomfortable, I suggest that you don't watch. What we're looking at are residue and particles that are being pulled from deceased humans from inside their arteries and veins. Sounds hard to believe, and it sounds like you'd be hearing about this on the news, but it's not something that's being widely reported, which is why I am doing this special feature on it. Now, I'm going to simply play what John is saying, and then afterwards I will give you my feedback if I have any, and possibly even during I will possibly do some commentary. So without further ado, let's see what Dr. John Campbell has to say.
Well, a warm welcome to the first embalmers in the world to notice these white blood clots. Well, a warm welcome to this talk, and I'm delighted to welcome Mr. Richard Hirschman from Alabama. Now, Richard was one of the first embalmers in the world to notice these white blood clots and to start photographing them and taking notice of them, a new pathology. Richard, thank you very much for coming on the video.
Thank you, John. I'm glad to be here.
Now, you're actually a professional embalmer, Richard. How many bodies a year will you embalm?
Well, I'm a trade embalmer, so that varies depending on how busy the funeral home is and if they want to call me or not. But I probably embalm at least 300 plus bodies a year. Sometimes I've embalmed up to 650 in a year.
And how long have you been embalming for?
I started the profession back in 2001. I recall being in the funeral home as an apprentice when 9/11 happened. So it's been a long time. Now, I finished mortuary school in 2004 and became duly licensed. You know, we have to do an apprenticeship first before we can take our national board exams.
Now, you first saw these clots early 2021. March or April time 2021. Have you ever seen anything like these white clots before in your entire 23-year career?
No, John, I haven't. And I remember the earlier times of when I first saw it, I was shocked, and I just, kind of overlooked it as a strange anomaly. But when I started seeing it more and more often as the year went along, I started asking other embalmers and professionals that I work around and with, had they ever seen it? Some of these people had up to, 30, 40, 50 years of experience, and none of them had witnessed these types of clots either.
So it's interesting, Richard. So far, I've spoken to 3 medical professors about half a dozen doctors and at least one pathologist, and none of them have seen anything like this before.
I just want to pause and point out that what is being reported has never been seen before. And these are seasoned professionals that have been in the industry for decades. This one gentleman, he worked on bodies from 9/11 in that area of time. So he's been doing it for 2 decades. John himself has been asking around, and nobody's ever seen this before. This is a new pathology, something no one's ever seen before.
They simply hadn't seen it. This seems to be a completely new pathology that's being identified. Now, had you seen any of these clots in 2020 prior to 2021, in the first year of the pandemic in 2020?
No, I did not. I did notice towards the end of the year of the second half, more in the fall and the winter, I did notice an increase of clotting issues, but they were more typical clots, you know, the grape jelly-like clots that we sometimes would run into.
But you'd seen these type of clots for your entire career. It's these new white clots that you first saw in 2021.
That's correct. And when I only had 3 images on my phone, I brought it to my doctor's attention, and he too had never seen anything like it. And he was so shocked that he brought another doctor into the office to look at these pictures. And the 2 times that I visited him after that, he was always asking about the clots, but he could never explain it.
Now, of course, it's interesting to try and correlate the onset of these clots that you first saw in March, April 2021. Just out of interest, when did the COVID-19 vaccine rollout begin in Alabama in your area?
Right around here, it was probably January of 2021. And John O'Looney had put out a video later on in 2021, somewhere in the fall. And when he described what he was seeing in his funeral home, it was the same thing I was seeing. And that was a huge influx in January of 2021. It's the busiest I'd ever been in my career.
Now, of course, we interviewed John O'Looney recently on this program, and he's a undertaker embalmer in England, and you're in Alabama. So we've got the same phenomena, these white clots, starting at the same time on 2 different continents. It's almost as if there's some common cause that's caused the clots to occur in England and in the United States at essentially the same time.
Right. You know, when he was talking about his experience, now he didn't show any pictures or images, but when I saw his video in it was probably around maybe October of 2021, I realized that it wasn't just me over here in Alabama, that this was reaching all the way over there in the UK. And when he talked about his embalmer seeing clots, like, you know, the clotting issues were really, really bad, my thought was, these are not your typical clots. They're different.
So going back to 2021 in October, the different embalmers were reporting seeing these clots in the veins. That's pretty intense.
So we know that fairly early in 2021, these clots were occurring in Alabama and England. And presumably, Richard, you've got embalmer colleagues that you're able to communicate with in different parts of the United States.
Yes, I reached out to several of my colleagues. I have some that were up in Tennessee, and all around my area for sure.
And moving on into 2022, 2023, were you still seeing these white clots?
Oh, I see them right now on a regular basis almost, and the frequency at which I see it fluctuates. It's kind of up and down. Um, Overall, I would say at least 50% of the bodies have some form of these clots. Now, not always are they the real big ones that I see. Sometimes they're smaller, but they're all very similar to this kind of white fibrous looking tissue, and that's what it looks like. It looks like tissue, not like blood at all.
And what does it feel like? Is it sticky? Is it elastic? Is it fibrous? Does it crumble in your fingers?
Those white things that he just showed in that bottle are the fibrous things that they're pulling out of the people that he's talking about. So we'll see a close up of that again soon.
Is it stretchy?
No, a typical blood clot in the past is like grape jelly. At worst, maybe a grape jam. But and when you try to pick it up, it falls apart in your hand. It almost dissolves because the blood just crumbles apart, and it's very slippery and slick. These I can pick up with forceps. I can stretch them like a rubber band. They will break if you put enough uh, tension on it, but they're way stronger than any clot that I'd ever seen before.
Quite incredible, really. So up to 50% of the bodies that you are embalming have got these white clots in them. Some are bigger, some are smaller, but you're seeing these in up to 50% of the bodies.
Right. And the only thing in the past that would see would be what you might call chicken fat clots. And we call them that because that's what they really look like. They look like a piece of yellow chicken fat. They're usually not very strong. They're usually not very big, um, but not these big, long, stringy things.
I'm just trying to get an idea of how representative a sample of those that die opt for embalming. I mean, what proportion of deaths in your area would you estimate opt for embalming after death?
What do you mean? The percentage of embalmings? Well, that is decreasing as time goes along because the cost of everything is getting more expensive and more people are opting for cremation. So right now it's probably about 50% of the bodies are embalmed, whereas before the majority of the people were embalmed.
So quite a high percentage, really. And I don't think there's any reason to think that the people that are opting for embalming or opting against not to get embalmed, I don't really see why there should be any difference between those two groups. So the 50% of people that you are embalming, I think, is a fair sample of the total number of people that died.
No, they're not, John. And that is one of my concerns. A lot of the people that are embalmed are older. A lot of the people had already made funeral pre-arrangements for down the road when they die, so it's been paid for. A lot of the younger people are opting for cremation because it's much more affordable on the families. And of course, with the high cost of the living, the the reason why more people are going to cremation is because it's just much more affordable.
Of course, you could still embalm bodies prior to cremation so that the friends and relatives can view the body looking in a more natural state.
We do, but that's still quite expensive. Um, but it does happen. We do embalm people that want to have a funeral service first and then to be followed up with a cremation later.
Now, are you seeing these strange new white blood clots in the arterial system and in the venous system?
John, that was one of the most concerning things that I was freaking out about because we would never see clots in arteries. The arteries were typically always empty. There was void of any blood in there. All the blood would be pretty much in the venous system, and it was in the venous system where we would see clots. I sent you some images we might discuss later. I have pulled some out where I've taken a ruler next to them. One of them is 33 inches long out of the artery.
Now that's actually just the first part of the video, but I'm actually going to leave it there for now and post this as a single video. The reason is I'm slightly concerned that there could be limitations on the pictures we're about to show. Now I am going to show the pictures in the next video, but I'm going to do it separately. Then if there's a problem with one video, at least we've got this bit done. But what we're clearly seeing is these new white clots, not seen before, not seen any time before in these embalmers' careers, but seen for the first time, bang, they appear in the record in 2021. Now, some of the embalmers in England saw very small amounts in 2020, but there we saw Richard didn't see any until 2021 and is still seeing them now. Now, do try and catch the next video. I'm hoping I'm going to be allowed to leave the next video up. So that'll be up probably shortly. But for now, thank you, and we'll leave that one there. But definite questions to be answered, I think you'll agree.
I couldn't believe these shocking facts about women.
Okay. You can see here I've got White Clots USA Part 2. That was the first, and we're just going to go right into this now. And yeah.
Now, of course, the main question in my mind, and I know in your mind as well, Richard, indeed in minds around the world, is just when are these clots forming, or these fibrous structures, protein structures, whatever we're going to call them? Is it before death? Is it a long time before death? Are they there for weeks? Are they there for months? Are they there just in the minutes before death? Are they forming during the dying process, or are they post-mortem clots?
Just to recap, they don't know when these structures are forming in the arteries, before, during, or after death. Interesting question. Interesting question. And John is going to lead us down the path, and they're going to talk about everything that they know. This is really intense, and I know it's controversial. But what we have here is we've got direct evidence from an actual embalmer in Alabama, in the U.S., that's going to show us what he's found. And it's not just him. And it's other people, it's other embalmers. John has mentioned it. And all of the statistics point to this not being an isolated case, this being some sort of new pathology, as John had said. And it's something that we need to be aware of. So that's why I'm sharing this information, and I hope that you find solace in knowing that there are people out here that are looking into these things, trying to understand what's going on, trying to figure out where these things came from, and bringing the evidence to light, because it's not something that anybody wants to do. It's hard, and you get labeled things, and the truth is that we just want answers. We don't know what these things are. We don't know where they're coming from, but we know that they're here. And that's the important thing. Let's look at it. Let's figure it out.
And I don't think we have a definitive answer to this, but you've been a bit of a hub really for people sending you pictures. And we've got 2 pictures from living patients here that you have got express permission to share. So let's look at those now.
I was sent that image by a doctor, and this is apparently some kind of a drain tube that was allowing some fluid to drain off around or near the pancreas, if I recall. But it wasn't actually in the vascular system. And they found this really interesting. And the most alarming thing is it looks very similar to the same clots I'm seeing. And this person is still alive.
And this specimen is also from a living person, we believe, Richard.
Yes, that is the specimen that we just looked at that was put into a container, and you're just looking up at it. Look how it looks ropey.
Well, it does look very similar, doesn't it?
Absolutely.
So, whose hand are we looking at here, Richard?
That's my hand. That came out of the carotid artery on the right side.
And I think we can clearly see it's taken up the shape of the inside of the blood vessels. It's almost like a cast of the inside of the blood vessels with a bifurcation where the arteries would divide.
It felt like a squid, very rubbery.
And just think what that would do to the blood supply in a living person. It would just stop the blood supply if it occurred in life and would be the cause of death.
Right, and John, that wasn't even rinsed off. It came out just like that. You still see the blood stuck in a couple of parts of it.
And you took that image yourself, Richard, personally?
Correct. Yes. Now, this specimen right here, I don't remember the exact case, but the interesting thing is if you see the dark black, reddish looking stuff, now that looks almost like a typical blood clot. But it's that white fibrous strand that is seriously unnormal.
And as we've said, this is a new pathology. This white material is new. The red blood clot we've seen before, but of course, this white material is a new pathology. Now, this picture here is usefully giving.
It's pretty amazing that all of that was pulled out of people. And we've got some more here to take a look at. We don't know where it's coming from. We don't know why it's here. We just see it arriving the same time that other stuff happened.
There's a sense of scale.
Yes, that's about, if I recall, that's about 17 inches. Those came out of the jugular or carotid artery in the neck. Now, this person was diagnosed with blood clots, but the inflammation around the heart was so bad that they couldn't do surgery fast enough in order to remove them.
So it's quite within the realms of possibility that these clots were the cause of death in this particular individual.
Well, according to what I was told, he was in the hospital for blood clots, and they wanted to do surgery to get him out, but they didn't have enough time.
I mean, that's just huge, isn't it? I mean, it's reasonable to assume, I think, that would essentially close off the blood supply if the patient were alive with terminal consequences.
Now, John, I'm glad you bring that up because people will say, well, I don't know how that's possible. But I believe what happens is if these are forming the white fibrous stuff and it's just that, there's enough room for the blood to go around these clots.
Interesting. So your impression is it's not a complete cast of the inside of the vessel. It's like a sort of string following the internal lumina of a vessel rather than something that's going to block it off completely.
Well, not totally. Not totally. You're going to have an image you're going to share that I'm going to explain that a little bit better on coming up.
Now, this next specimen here that we see in a jar, it was actually taken out of a tube that was carrying the patient's blood prior to their death. So the patient had this tube attached for a medical procedure, their blood was flowing through it, and then you took this out of the tube because the tube was supplied with the body of the patient.
Correct. Yes, and this was one of my first 100% confirmations that these clots can form post-mortem, because at the end of the tube was a where the blood goes in had small holes in it, allowing the blood to enter the tube or go through the tube. These clots were way too large to go through those small holes, so it must have formed inside the tube that was holding the blood.
Well, this is giving us pretty conclusive evidence, really, that these clots can occur post-mortem. But we also have strong suspicions that they can occur around about the time of death or before death and be involved as a cause of death as well.
Yes, I spoke to a lady just a few days ago who lost her 25-year-old son, and she's going to share her story, her son's story, but she spoke to the surgeon and asked the surgeon if when they were trying to remove the clot from this man, was this a fibrous rubbery clot? And he confirmed with her it was. And when that surgeon was trying to remove it, it broke free. Her son ended up in cardiac arrest, and they tried for over an hour to revive him, but unfortunately he didn't make it.
Now, I do have quite a few more specimens, but I think we might be dealing with the art of the possible here. So we'll just put that up as a short section because I really wanted to get those specimens to you. This is the physical photographic evidence. These strands of white material exist. There is more to come, but we'll I think you get the message. We'll see how this goes.
Do you know what happens if you pour sugar into a carved out
That is absolutely insane. Insane. We don't know what there are. We don't know. We're not sure where they're coming from, right? We're not sure exactly how they're forming. We know that there's some correlation, but that doesn't necessarily mean causation. What are we looking at here? If you have any ideas, put them in the comments. Really looking for some ideas here. That's all I've got. Stay tuned, and we'll see what else comes up. So that's all I've got for now. Thanks for watching, and be well.